Hello, it's good to be with you again. It's been just over a month since I did my initial 180-day plan, and I shared it with you by video like I'm doing today. To give you a quick recap on that 180-day plan and the process, what I shared with you in my initial recording is that after doing about 5 weeks of transition briefings and meeting with staff and leaders and frontline employees in the organization and our labor partners, that I was going to put together a strategic plan that I thought was important to our organization for the next 100 to 180 days, depending upon the scope of the priorities, and then I'd share that plan with you. And so that's what I did in my initial video. We did go with 180 days because some of the changes that were required were substantial, but I felt like the plan was going to get us to where we needed to be at the start of the next fiscal year. So I won't go into a lot of detail over every one of the initial 180-day plan items, but I will just breeze through them with you as a refresher. If you would like, you can always access that initial video on our homepage and get a refresher on a bit more in depth of that initial 180-day plan. But here's the recap. What I heard from staff in my transition briefings were things like operating as a healthcare system, that they felt like we had some inconsistency at each one of our major campuses and that we needed to operate with a bit more consistency. So we'll talk a little bit about that and later in this video. You all also share with me the desire for increased accountability in our organization. I had requests from staff to focus more on the veteran experience, but also focus more on the employee experience. There was quite a bit of dialogue about scheduling, both scheduling processes, the staff that were involved in scheduling processes, and maybe a different way we could handle those staff. So I'll actually give you a brief update on that one today. There was a bit of feedback I received about responsiveness from facilities, or particularly engineering and repairing things in the organization. So there'll be some discussion about that on today's video. You talked to me about recruitment processes and onboarding processes, so you'll get an update on that today. You also shared with me a perception that we didn't effectively use our space and that maybe our facility strategic plan wasn't something that either staff were aware of or that we didn't effectively do. So I'll give you a brief update on that myself. We talked a little bit about housekeeping support in several areas across the organization. And last but not least, you share with me some perceptions about labor and management's relationship in the organization. So in today's video, I will not actually go through each one of these items and give you an update personally. Instead, you're going to hear from several senior leaders and service chiefs in the organization that have taken personal ownership for a number of these initiatives, and they'll be sharing those updates with you. Specifically, you're going to be hearing from Dr. Fashna, our Chief of Staff, and Brian Sisk, our Associate Director for Patient Care Services. They're going to be talking to you about PACT optimization. This was something I shared with you in the initial video, and an emphasis on improving the way that we practice in primary care and doing it with more consistency across the organization. This has been one we've tracked regularly. We discuss it almost on a daily basis in Morning Report. And Dr. Fashna and Brian, as the senior leaders are responsible for this particular metric, are going to be sharing with you what they've done with others in primary care and ambulatory care to get us to where we need to go. So I hope you enjoyed that update. You'll also be hearing from Dr. Sika, our Chief of Medical Service, and Dr. Idson, our Chief of Surgical Service. The two of them are going to be talking to you about provider productivity. Something else that I mentioned to you in the initial 180-day plan video, and that we had a few areas that are at least the data that was being reported as to how effectively we were using our most expensive human resource just didn't put us in the best light in some cases. And there were several subspecialties I had a special eye on and wanted to see us make particular improvements. So you'll get to hear from Dr. Sika and Dr. Idson talk to you about their specific initiatives focused on provider productivity. You're also going to hear from Amy Maynard. Amy is our Assistant Director at our Waco campus, but also the Senior Executive that supervises engineering service. So Amy is going to be talking to you about an engineering customer service survey that was developed as a direct result of your feedback, but also giving you an update on the facility facelift that I also shared with you in my initial video, and tell you about some of the areas that we're going to be replacing flooring and doing some paint and some other facelifts in the organization as we continue to try to modernize our facilities. Last but not least, you're going to be hearing from Andrew Garcia. Andrew is our Associate Director. Andrew is going to be talking to you about the $10 million spend plan that, again, I shared with you in that initial video, and giving you some updates on where we are with certain equipment and contracts that we're going to be awarded as a result of that $10 million spend plan. But we'll also be talking to you about some of the joint training that we're going to be doing with our labor partners, in addition to the hiring processes that you all shared with me in my transition briefings, and what he and our leadership and human resources are doing to streamline that process to the best of our ability. So there are a few updates that I'll give you since I am with you today, also related to the 180-day plan. First, under the item that you all brought to my attention in my transition briefings related to scheduling. What I shared with you in my initial briefing was that there was a plan that was presented to realign some of our outpatient scheduling staff to the services which they support. So what I shared with you in the initial video is that a proposal had been made and that I approved that proposal. But we've actually started setting dates for the transition of our outpatient medical support assistants to the services that they support. And right now that date is August 1st. And notification has been sent to our labor partners, and we'll be working with the services and those employees that will be affected to ensure that on August 1st, the outpatient medical support assistants that are transitioning from medical administration service to a variety of clinical services have as smooth a transition as possible. But I am looking forward to that transition. I also shared with you in my initial briefing that we were going to be having a strategic planning summit. We have actually set dates for a strategic planning summit. Those will be towards the end of July. I believe right now our dates are between the July 25th and July 27th. This is going to be a very important initiative for Central Texas, and this particular strategic planning summit is going to be focused on our community-based outpatient clinics. As we're looking to get care closer to the veteran, not only do we think this is going to improve the veteran experience, but we also think it's going to improve handoff and other patient safety indicators. So what we're actually looking at this July summit are each one of our community-based outpatient clinics and what additional services do we want to consider adding at those sites. At the moment, the majority of them are primary care and mental health specifically. But we're going to be evaluating adding specialty services there, whether they be optometry or ophthalmology or cardiology services, but making those decisions based upon referral volumes that we see now. It is going to be a new initiative for us. I'm looking forward to the results. Andrew Garcia and our planning office are putting this together for us. But what we're also including in these discussions are veterans, whether they be veteran service organizations or veterans that are receiving their care at these sites, so that they have some input into the final decisions that we make and the packages that we subsequently send forward to modify those locations. Last but not least, under the category of management and labor relations, what I shared in my initial 180-day plan is that I was going to be doing joint focus groups with our labor partners, and we've started doing those focus groups. To give you some clarity, the focus groups were focused on our all-employee survey results from last fiscal year. Specifically, we agreed that we were going to focus on the lowest scoring 14 work groups. And by lowest scoring, we used a particular metric defined as best place to work. And there was a question that our employees answered on the survey that said, I would identify my workplace as a best place to work. Higher obviously being better, and lower showing us that we had some opportunities for improvement. So we identified those 14 work groups that had the lowest scores in the organization and have been actively meeting with them without their supervisors present so that I can get unfiltered feedback from them about what their experiences are like in their workplace, and to identify those things that both I can do and I can do jointly with their leadership to improve their perception of their workplace. These have been very engaging discussions, and I appreciate the staff being as candid with me as they have been. And we'll continue to meet with those employees in those 14 work groups to ensure that we are making an impact on their work experience on a daily basis, and look forward to seeing some improvement in those scores with the new all-employee survey that's coming. A few other things that have occurred since my last video update to you. We have had a number of employee appreciation events. I want to thank all the staff that were able to come out to those, and you really can't say enough, again, to thank you for what you do for our nation's heroes. At those employee appreciation events, we've also taken the opportunity where we can to educate staff on SAIL, which it was also something I shared with you in my first video, and that as we want to continue to be a provider of choice, it's going to be highly contingent upon us as an organization continuing to learn and continuing to be better tomorrow than we are today. So with that, I hope you enjoy the updates that you'll hear from the rest of your senior leadership team, and thank you for choosing Central Texas.
I'm here to give you an update on the Director's 180-day plan. Specifically, I'll be talking about PACT optimization. PACT optimization, as we define it, we're looking at the access numbers. What is the percentage of patients we're able to see within 7 days of their indicated date? We're also looking at the panel sizes. So using both metrics, we compute which of the panels are optimized. Getting there involves a lot of work by the whole team. It involves a lot of work by leadership, ensuring that you have enough staff to get there. It also involves looking at the processes within the team, looking at the team communication, the team dynamics, ensuring that we contact our patients, and that is where you come in. The staff come in by proactively looking at their appointments, proactively evaluating what the patient needs are, and ensuring that our veterans get those needs met as quickly as possible. To get there, we have been hiring quite a number of teams. We have added packed teamlets at many sites. We have added space, and we will continue to do so. I'm pleased to report that in the last 60 days since we started on this journey, we have increased the numbers of optimized teamlets by about 40%, starting at 12 teamlets at the beginning of April to the current number of 17 teamlets. And we fully anticipate that with your help, we will continue to meet those, to increase those numbers. I want to make a special mention of the Women's Clinic in Austin. Some of the processes that they have put in place have greatly reduced the numbers of walk-in patients that they have seen. We are hopeful that those improvements will continue and that other teams around the system will achieve those same results. Mr. Sisk will now give us some more tips on how we're going to continue improving.
Thank you. So during this last 60 days, we've really made an effort to gather input from staff. And as far as PACT optimization goes, one of the things we've done is really compiled that input into a PACT playbook. And what this has done, it's allowed us to standardize some of our processes. Like Dr. Sheen was saying, be proactive in how we're looking at appointments. If we can deal with the veteran's needs before the veteran needs an appointment, then we can actually free that appointment up for somebody that may be 30 days out or 45 days out, which none of us want that. Our teams are huddling on a daily basis to include all the teams, which again includes talking about what the challenges of the day are and how they can as a team work through those challenges. Again, something that's very proactive and team building. And a couple of these other efforts that we've talked about, just to give you one metric that really stands out to me, is our 2-day post-discharge phone calls. Again, if we're making contact with our veterans after they're discharged from the hospital, we find that they walk in less and that we can actually deal with some of the needs they have at home before they're admitted back to the hospital. We've gone from many of our teams were in the 20% range to almost all of our teams are now exceeding 80%. So a dramatic improvement. You couple this with some of the other things that we put into place, like our call center, that does include nurses that can triage and help veterans over the phone, thus eliminating the need for a visit a lot of times. We're starting to see our access open up, which is really what's helping with our PACT optimization progress. And that's work that you've done, and we thank you for that, because that's not something that happens overnight. It's a lot of hard work, and a lot of our staff have put in many hours to make these improvements. I'd like to end up and just talk a little bit about the patient rounding. That process has officially started at 1 June. Like the director had outlined in his plan, and I'm really happy to say we're getting a lot of good feedback. Everything from being able to identify equipment shortages to also recognizing those individuals who go above and beyond in everything they do. And that gives us an opportunity to recognize our staff and do that in a timely manner. And we thank you for that. So please keep up the good work, and thank you for what you've done.
I and Dr. Eidson are going to talk about the medical and surgical subspecialties and provide an update on the SPARC quadrant reports and the physician productivity, especially focusing on the subspecialties which are below the 25th percentile in the SPARC report. Overall, as a chief of medicine, I'm very proud to lead the medical service, which has 11 subspecialties, and all our providers are doing an excellent job providing great care, timely care, and working really hard every day to accomplish that. There's one medical subspecialty which in terms of productivity is below the 25th percentile. However, this does not mean that the care is any way substandard. Actually, the care is comparable, if not actually better than the other VAs or other institutions. However, there were some things which needed to be addressed to capture that workload and reflect it in the reports. So we have taken multiple steps, including a extensive review of all the subspecialties and more so for dermatology. First thing we did was to review the labor mapping. Labor mapping is a reflection of what each physician does during their day in a VA, and that in turn reflects on the productivity. We have reviewed it and made appropriate changes to reflect the labor mapping so it captures their teaching time, their administrative time, their research time, and clinical activities. Another step we have taken is we have collaborated with Chief of HIMSS to improve the coding and documentation part. Dermatologists were doing the procedures and seeing patients, however, they were undercoded and not appropriately captured. This will significantly improve the productivity and the numbers. Ms. Spence has worked closely with our providers in providing the education and improving this. Lastly but not least, we have reached out to another VA, which is the Seattle VA, to collaborate with them for teledermatology. We will be storing and capturing our teledermatology images to this VA so they can review and provide the care, and in turn this will free up time for our providers for more face-to-face visits and to do more procedures, and this will definitely improve access. I'm very confident that the steps we have taken will improve the numbers for dermatology, and dermatology will be one of the highest and most improved in terms of productivity and access. And we should see similar results with other medical subspecialties. I will hand it over to Dr. Eidson.
Great, thank you. First thing I'd like to say is it's been an honor and a privilege to lead the Department of Surgery at this institution. Our surgical department delivers the highest quality of care with outstanding record as far as mortality and morbidity in our surgical patients compared to the national average and even the private sector. We have 14 sections in the Department of Surgery, all led by hardworking surgeons and clinicians, and I appreciate all of their dedication and their time. Within those 14 sections, there have been 3 that are in the bottom quartile regarding their productivity. Similar to medicine, we have worked with our coding experts as well as our labor mapping individuals to make sure that everything is optimized with respect to getting credit for all of the hard work that they have done. We have reassigned certain physicians. We have reduced FTE where appropriate. Most importantly, we have started to address the increasing trend of our operations going outside of the VA system. By carefully educating our patients and our providers within the system and letting them know about what we can offer here, we've been able to recapture much of that workload that has been leaving our facility for the last 2 to 3 years. Looking forward on down the road, I am very optimistic about our efforts to retain many of these surgical patients, and I look forward to seeing all of our sections thrive as we would expect. I look forward to working with Dr. Sika as well.
The first update I wanted to give was on the engineering customer service. We have sent out a survey to all management and supervisors. Once we have the results from that survey, we will use that feedback to make plans to improve our customer service. Between the information we provide, the timeliness of the responses, and just basic interaction with the services to ensure that we are improving in that area. The next thing I wanted to update on was the Halls and Walls projects for engineering. The team has been amazingly busy this past few weeks working on our ICU area. They have made amazing changes in this area. They've replaced walls, painted all the rooms, the ceilings, the nurses' stations are completely redone. It almost looks like a brand new area. You can't recognize it when you walk through. They will be completely finished with this by the middle of June, and that's when we're projected to move the patients back in. Once they complete this project, then they will be moving on to additional projects throughout our facility. This will include halls and walls in our patient traffic areas. Primarily, they'll be focusing on the basement and the first floor in the areas that have not already been renovated in the previous halls and walls project. Along with this, we are also increasing our staffing for our construction crew, both in Waco, which is actually establishing a new team there, plus we're increasing the number of staff we have on our team here in Temple. This will allow them to complete more projects in a timely manner and be able to make some big differences that you'll be able to see in the near future in our campus.
There are 3 topics that I will be discussing today. The first being hiring timeliness, the second being supervisory training, and the third to discuss some of the initiative funding requests that have come through and been approved at the director's level. The first item for discussion is the hiring timeliness. You've spoken and we've heard you. We understand that there are some concerns with the timeliness of the hiring process here at Central Texas. So just so that each of you know, we've implemented a Lean Six Sigma project to review the hiring process from start to end. Our objective is to improve that process from tentative offer to EOD to be 30 days or less. This project is put in place by our chief of HR and is being managed by our systems redesign group to help us move this thing in the right direction. In addition to it helping us identify where these gaps are in the hiring process, our HR services put together a master spreadsheet that has outlined various steps in the process so we know at what time the positions were either approved, what time they were announced, the time that selections were made, and the time that the EODs actually occurred. So we'll be tracking each step in this process every week. This document comes to me and is sent out to your respective ELT member. So be expecting some further discussion from your ELT member with you and your staff to discuss progress being made in some of these recruitment actions. The second topic has to do with supervisory training. We all have heard and discussed the need for additional supervisory training for our supervisors. So it's starting in FY18, it will be mandatory that all supervisors within Central Texas receive 20 hours of refresher training. These schedules have been put together by HR and are currently being tweaked a little bit with the assistance of our AFGE partners to ensure that we include some of the topics they would like to include in these supervisory trainings. So that list of requirements will be pushed out probably by August, just to give everyone a heads up as to what courses are available, and so that supervisors can begin signing up for those training classes. The last item has to do with our initiative funding request. As was mentioned earlier this year by our director, he approved $10 million in initiative funding to move towards things such as improvement of the canteen service. It's a very big project. We will be later this year starting the planning process to improve the kitchen, the canteen store, as well as the dining room. All this will come with new furniture and equipment, so we are all looking forward to a fresh makeover of those respective areas. Additionally, the director approved waiting room furniture for all waiting rooms at both the Temple and Waco campuses. So that is currently sitting with our contracting office, and we look forward to receiving that furniture and deploying it to those areas as needed. Another area that I thought I'd bring up, and it's very timely because it just came up this morning, is relates to our CALs, our computers on wheels. We approved, or the director approved, a purchase of additional 250 CALs that will be deployed once they are awarded and arrive on station. This will obviously help in many aspects of the clinical care that our providers and nursing staff provide to our patients.